Well, good afternoon for everyone that's on the Central and Eastern time zone, and for our folks out on the Pacific Coast, good morning. We're so excited to have you join us here for the first Building Community Resilience webinar. Today we are going to share with you our lessons learned in building coalitions and communications tools for these cross-sector collaborations that we're doing across the country. A bit of housekeeping. We have muted all mics, so please use the chat box function for questions and comments, and we will certainly leave time for your questions at the end of the webinar. My name is Wendy. Next slide. Next slide. My name is Wendy Ellis, and I am the project director for the Building Community Resilience Project here at the Milken Institute School of Public Health at George Washington University. As I said, we're going to share our experiences from the first 2 years of the BCR collaborative efforts to help child health systems and community partners to build coalitions to address adverse childhood experiences in the context of adverse community environments. Joining us today is Logan Lynn, who is the Chief Impact Officer at Trillium Family Services, which is the backbone agency for our Portland BCR site, Mark Dessauer at Spitfire Strategies, who helped develop the communications guide, and Linda Sheriff from the Center for Health and Healthcare in Schools at the George Washington University, who helped develop the tools that accompany the guide. Next slide. If you haven't already done so, please download the guide and tools at the go.gwu.edu/BCR and follow along as Mark and Linda walk through the guide. Next slide. So let's set the context for our work, the pair of ACEs. This picture is actually a BCR communications tool. Later, you'll learn how it can be used to start a conversation, particularly across sectors. But first, let's define the problem we aim to solve: adverse childhood experiences in the context of adverse community environments. So as we've come to know and as we communicate in BCR, that what we've traditionally defined as adverse childhood experiences, those categories that we see above the root line, are the things that we easily recognize in a number of different settings, whether that be maternal depression when we're in a pediatric care setting, whether that's emotional and sexual abuse that we witness in a police setting, or homelessness that we see on our streets. These are things that, just as a tree, are the leaves that are the symptoms that we see of the soil, poor soil, that our communities are rooted in. And so these things really, when you begin to look below that soil and you see some of the contributing factors that are embedded in our communities, you begin to realize that this goes beyond a clinical or social service intervention, but something that requires the response of multiple sectors. And that's the power of this tool that we've created, is to help you begin to have those conversations and help other sectors see their role in responding to the pair of ACEs. Next slide. So what the tree depicts is the accumulation of stressors within the home and the environment without access to buffers, what's become known as toxic stress. These stressors, as depicted in the tree, are poverty, violence, homelessness, parents being incarcerated, maternal depression. Certainly this does not mean to be an exhaustive list, but this gives you an example of those adversities. When combined with the community accumulation of stress without those buffers, that's when we see how it gets under the skin and actually results in health outcomes, negative health outcomes, whether those be depression or other mental illnesses, high blood pressure, alcohol and drug abuse, diabetes, and other behaviors that aren't necessarily healthy. Next slide. So as the science shows us, toxic stress is a real physiological process, different from episodic stress, such as having a bad day at work, getting stuck in a traffic jam, or soothing a fussy baby. Toxic stress is unrelenting, constant, and occurs when a person does not have access to support or buffers to offset the situation. It has real physical and neurological impact that is associated with devastating effects for the development of young children. Next slide. Understanding this science behind toxic stress and ACEs, we sought to provide a framework where child health systems, communities, and other sectors could collaborate and coordinate services and resources to reduce and prevent both ACEs. BCR is a systematic approach to create shared understanding, assess the state of readiness for an organization, community, or system, create cross-sector connections, and engage families and communities in building more resilient environments. Today's tools are essential in helping you create shared understanding so that you can be most effective in other areas of the approach. Next slide. These tools are informed by the work on the ground in the 5 BCR sites where teams have been applying the BCR framework to their own organizing efforts. This includes Portland, Oregon, Cincinnati, Ohio, Wilmington, Delaware, Washington, D.C., and Dallas, Texas. Next slide. BCR was born out of the need to address population health and improve early detection and intervention for children who have been exposed to ACEs. Despite the clear science connecting ACEs to long-term negative health outcomes, many physicians lack partners to address the issues embedded in community. There's just no prescription for many of the needs presented in a clinical visit. So how do we translate what we know about ACEs, resilience, and social determinants into action? That is the aim of BCR. Next slide. Understanding the multiple pathways and factors that support individual and community resilience provides further evidence for a multi-sector, multidisciplinary approach to building community resilience. Buffers at the community level inform supports at the family level and vice versa. As this chart shows, resilience is multifactored and informed across multiple dimensions of our community. Next slide. So where to start? Many of our teams are building off of the community partnerships and the lessons learned in their obesity work and asthma work in community. They're deepening the work with families and community stakeholders, and this is helping them to work across sectors. Next slide. The common barriers we sought to address by creating coalition building and communications tools are how do you engage families and communities outside of a clinical or some other professional visit? How do you foster buy-in within systems? How do you remove barriers across sector? What about sharing data that's meaningful as well as measurable? And what about the financial sustainability of this work? Next slide. So what does successful coalition messaging look like? I'd like to introduce our partner, Logan Lynn from Trillium Family Services, the backbone organization for Portland BCR. Trillium has built a dynamic, multi-pronged approach to working across sectors and engaging community around improving mental health and addressing ACEs. Logan?
Slide. So as Wendy mentioned, I run a campaign and social movement, founded it here in Oregon, called Keep Oregon Well. You can look at the site, our main site, at www.keeporegonwell.com. But a few years back, Trillium Family Services, which is Oregon's largest provider of mental and behavioral health care for children and families, led down the path of trauma-informed care under the sanctuary model. Next slide. And what we did from there is started internally with our clinical teams, really learning about how trauma affects all human systems, including our organization. And that led to a deeper understanding of how, particularly in Oregon, Trillium, which has been around in some form for over 100 years, has been part of the structure of systemic racism, has been part of the sort of keeping communities separate. And so we also realized that in that we had an opportunity to be part of the solution, to lean into trauma-informed care in a way that started to think about whole people, and social determinants of health, and how we can't have a conversation about trauma without talking about racism or homophobia or transphobia, and how you can't really have a conversation about community trauma with just the healthcare system, and how do you reach people. So I came, historically, I worked for MTV, I did the branding for American Apparel, I came from a for-profit world, but have been successful in my own life around mobilizing community, around issues of recovery, around issues of mental and behavioral health care. I am a survivor myself. I'm a person who has found real power in harnessing my own story in my own life, and so we wanted to apply that sort of science to the community and created this coming out movement called Keep Oregon Well. Next slide. So what we do, our mission is to make Oregon a safer, more supportive place for all people to live, work, play, and learn, which sounds easy, I know. But to any of us doing this work is the task at hand that feels most challenging at times. Like, how do you make space at the table for everybody? How do you work in community in a way where you're acting within community and not upon community? Next slide. So our values, and I won't read through all of these, but they are based on the sanctuary principles, which is a trauma-informed care model, like I mentioned, as well as equity and inclusion principles and empathy around what we feel like we could organize around. So visibility and empowerment, empathy, nonviolence, emotional intelligence, inquiry and social learning, equity and inclusion, democracy, meaning everybody has a voice, not necessarily a vote, open communication, social responsibility, and growth and change. Next slide. So when I was tasked with moving these principles out into community, you know, we thought about what that would look like and how do you reach community. And I think, you know, our initial conversations were around how did we all learn our ABCs? And I know for me, I learned my ABCs through music. I can also list off all of the books of the Bible still as a 37-year-old man, and I learned that through song. And so we thought, first of all, who are we trying to reach? And at first, we were trying to reach our internal staff. So there was a bit of community engagement internally around sanctuary principles, around taking the pledge to fight stigma, which is the principles I just showed you. And then we started thinking, who are we not historically reaching? And that has been, you know, the teens and tweens market. That has been people of color. That has been LGBTQ communities, amongst others. And we started to develop a plan for how to provide the most access points possible. And so in the marketing of Keep Oregon Well, in the marketing of trauma-informed principles, it's all centered around the pledge. If you go to keeporegonwell.com, there are a bunch of different buttons, and each of those buttons represents an access point for community. So there's resources, there's events. We have a concert series where we've partnered with everybody from Kevin Bacon and his brother to Of Monsters and Men and Charlie XCX and Miley Cyrus. These really big name pop stars. We go and we have this concert series where I interview them about their own mental health and self-care, and then they play a few songs, and we send that out to all their fans and all of our people. And that's been a really almost instant way of reaching people we've never been able to reach before. And ultimately, I think we know that to reach teens and tweens around issues of mental and behavioral health or issues of trauma and resilience, we needed to make it cool. And so that happened in a series of ways. One way is, like I mentioned, the concert series. We also have been making comedic web shorts where we lampoon stigma as being ridiculous. We have a street team that goes out to events, and we're reaching about 1.5 million people every week with our messaging. One really cool part of this has been, and this was not why we did it, but there's been a development angle as well. So around community engagement, we have been able to also have some strategic asks of the community and the coalition that we've built. We had the opportunity to fund a new children's mental health high acuity residential sensors, state of the art. And we sent out on our Keep Oregon Well blog a button that you could push that would automatically send a form letter to the legislative representative in your area from you, the reader. And we funded that project to the tune of $4 million overnight just with our blog. And so one of the ways we've sort of we've gotten to that point where we have that community is by breaking down real or perceived competition in the community with our partners, with people in the sector. And the way that I did that, one of the ways, was to create something called the Mental Health Heroes Awards. And every year we do a community-driven nomination process where our partners, our former competitors, frankly, nominate the superstars at their organizations, nominate therapists in their lives, nominate people with lived experience who bravely told their stories, and we gather all those stories. We have a big party. We have, in the month of May, Mental Health Awareness Month, we highlight each of these heroes one a day. And it's been really cool to watch take fire. We also have spokespeople who are representative of different sections of the community, right? So I, as Logan Lynn, can't go into speak to veterans potentially, right? Because I don't have the lived experience of being a war veteran. But we have a spokesperson who's a conservative talk radio show host who actually has a lot of veterans that listen to his show. And so we partnered with him to do messaging to veterans this year. So it's really about finding who people are already connected to and mobilizing those communities through those people. Next slide. Some of our major milestones, like I mentioned, the Heroes Awards grew 300% from year 1 to year 2. This is our 3rd year right now that we're in. We just announced our heroes, and we had thousands this year. It's been really special to watch that happen. I also mentioned the Black and Gold Gala, which we were able to raise money around. All of our campaign vendors have become donors. And, you know, it's been shocking to me, I think, how when you start talking about ACEs, or you start really centering your business, your core business or your core messaging around resilience and recovery and empowering people, or giving them a safe space to stand up and say, hey, I'm Logan Lynn, I'm successful, and I suffer with depression. And both things are true, and both things get to be celebrated under our platform. We are really radically engaging the community around these issues. It's not about tolerance, it's not about acceptance, it's about celebrating our neurodiversity. And I think that's new. You know, and I've often heard a variety of feedback. You know, most of it's positive. Sometimes people say things like, I'm glamorizing mental illness. And honestly, I'm glamorizing mental wellness. But if we do glamorize mental illness and reassign humanity to those people who are suffering, then that's a byproduct I'm also okay with. I think this can happen with celebrities, as we're doing. This can also happen with, as Wendy mentioned, the community mavens, or who are the celebrities in your rural communities, or who are the celebrities within your organization, people who are thought leaders, people who are charismatic enough to deliver a message to people who have already established trust with those people. Next slide. So that's it. That's it for my presentation. I would love for you to all visit keeporegonwell.com, get involved, start using the hashtag Mental Health Matters, Resilient Nation. We can all connect on the internet from here, and I'm happy to answer any questions.
So Logan, thank you. I think an important contribution that you brought to this conversation today is celebrating neurodiversity. So that is our word for the day, neurodiversity. But Logan, there is a question from one of our attendees about the budget for this project. I think it's important because you had some really big numbers there as far as what you were raised, but it didn't always start that way as far as a big budget is concerned.
Right, that's correct. Yeah, no, the first year we had no budget, just me kind of parlaying my friendships. Like I said, I come from the entertainment music industry, so I was able to call in a lot of favors on the front end. And I think that applies to ours particularly. And when you're buying media ads, there's hard costs associated with that. We've core partnered with iHeartMedia, with Alpha Media, with our local NBC News affiliate, with the Portland Trailblazers, with different people who have either donated or discounted their own fees or time, but there are some hard costs associated with reaching community in the way that we're reaching community. So through those partnerships, there are ad buys. But the first year, it was all social. And I think that's the beautiful thing about finding spokespeople or finding your social network and building the coalition of thought leaders is that in a budget neutral kind of way, you're mobilizing their networks. So we started, there was no Keep Oregon Well, right? Like we started using my Facebook, which has 100,000 followers, and we started using CJ McCollum's Twitter, which has 60,000 people, and pretty soon we had enough of our sort of key players doing the messaging that it started to organically take hold. And from there, I was able to start getting investors. I was able to put together sort of an investment portfolio. After the first cycle of celebrating the heroes, those organizations wanted to get involved. And it has been an organic process ever since. But yeah, no, don't look at our flashy celebrity sort of expensive model and think that that's the only way to go. That's the way we're doing it because that has worked here for us. And it was frankly just the networks I had at my disposal. I would encourage this group to look at your network. Who do you know? Who do you know who's connected to community? And how might you partner with them to reach the communities they're connected to?
Thank you so much. I think that's a perfect note to move into the next area, Logan. You know, this is really about connecting into networks, and Logan's work demonstrates the effectiveness of leveraging social media in a grassroots campaign, and who knows how far it can go. But in the policy realm, oftentimes we need data to spur action. Next slide. So our BCR partner, the Child and Adolescent Health Measurement Initiative, created these analyses for our BCR teams to help educate policymakers and other potential partners about the widespread effect and prevalence of ACEs in Cincinnati compared to the state and the nation. As the saying goes, all politics are local. So it stands to reason you want to make your message about what is happening in your community with a quantifiable statement. Although these data were provided to BCR by CAMI, they are publicly available through the Data Resource Center, and that information you can find on our BCR website. When the Cincinnati team presented these analyses to a group of stakeholders, including the city's vice mayor, many were shocked by the numbers. In fact, the vice mayor remarked, "Why isn't anyone else talking about these issues like this? This is huge, and we should be addressing this in our city." Again, demonstrating the power of data. Next slide. Because BCR stresses a strengths-based approach, it is important to balance the message of adversity experienced in community with the factors that support resilience. Demonstrate what is going well and what we can do to prevent and offset the effects of ACEs. How safe do residents feel in their community? How well are children performing in school? Again, point out the areas where we can build an even stronger foundation for a more resilient community. As Mark and Linda will point out, highlighting resilience factors to build upon provides a starting point for new partners and policymakers. Next slide. Before we go into the guide, this is just a reminder, if you haven't downloaded it or the tools, they are up on the website. You can download and follow along as Mark and Linda go through its contents and tools. Next slide. The guide is broken up into 6 major sections. You'll learn about key BCR terms and concepts, many of which we've discussed today, the pair of ACEs tree, which is a key component of the guide, and we provide guidance on how to customize messages that fit your community. The buffers to resilience are explained, and you will learn how to incorporate this in your messages, as well as several specific story examples and talking points that will help you communicate across sectors and with community. So now I'm going to turn this over to Mark and Linda. Next slide.
Thank you so much, Wendy. I'm Mark Dessauer, Vice President at Spitfire Strategies, and really honored to be a part of this initiative.
Hi, everyone. I'm Linda Sheriff. I'm Deputy Director of the Center of Health and Healthcare in Schools at the Milken Institute School of Public Health here at GW University. I'll be speaking about the partnership and policy tools that we adapted for the BCR communities. Next slide,
and I'll be talking about the strategic communication tools and how these work together with Linda's tools there. So, as you see right here, that if you're going to work on ACEs, or if you understand that ACEs are being felt across the entire system, whether it's through hospital admissions for asthma, whether it's parents that are concerned in the community that there are stray dogs threatening their children, whether you have local funders that are funding early education initiatives, or the criminal justice system that is dealing with more and more youths being arrested, or education, and they're trying to work on attendance and improving grade and reading level, as well as faith-based organizations in the community. Each one of these groups may impact ACEs or may feel the impact of the pair of ACEs in various forms. What the goal is in making change happen in your community, you want to be able to reach out to those and lift up their understanding of adverse childhood experiences and adverse community environments. Build that shared understanding and language across each one of these areas. You want to be able to use their strengths and their experiences to build that coalition and use these tools to identify community resources and connect with these partners. All of this in service of advocacy for practice and policy change in the community as you start moving upstream to make the changes to impact the pair of ACEs in the community. Next slide, please.
So the tools that we're going to discuss will be useful to build a foundation for change. So what are the things that you will need to be successful? You need to have that common language and understanding of the problem. You need to have the knowledge of what already exists in the community, both the assets, what is already working and available, as well as what is lacking in the lack of resources. You need the knowledge of who is working on the issues and who could be potential partners. You also will need a smaller strategic group of partners who work on policy and procedure change, knowledge of the policy environment, and a messaging or communication plan. Next slide, please. So these are the tools that will help you identify, gather, and create the materials you need to put your action plan into place. The tools are a starting point and are meant for you to adapt to your unique environment and needs. They are to be continuously referred to, added to, and changed as you learn more, determine your goals, or the environment around you changes. Well, they can be used separately. When used together, they will increase your impact for lasting change. The tools are the Communications and Partner Building Guide, which Wendy discussed, identifying potential partners, mapping assets, connecting policies and procedures, being part of the policy conversation, the SMART chart, and the message box. Next slide, please.
So you've seen a lot of tools listed right there. We're going to share throughout the rest of this presentation several examples of how they work together in service of the BCR community partnerships. So in Cincinnati, the Joining Forces for Children initiative met with us to work on their strategic communications. And one thing that became clear, their coalition was originally organized by Advocacy and Policy. They had a committee for education and awareness, as well as a committee for activities and programmatic measures. And as we worked with that partnership, and as you can see right there, we have the message box tool, as we started asking what are the key audiences they want to impact in each one of those areas, it became clear of what they needed to do. Next slide, please. We moved from a coalition that was based around these three areas to a coalition that was focused on three key audiences. These audiences, as you can see, were early childhood, school-aged children, the healthcare system, and local initiatives and funders already working on children's issues. Each one of those were identified through the message box tool and the smart chart tool to say, hey, this is the type of change we want to see and make happen. So with the early childhood or local funders, you'll have advocacy and policy attached to those, as well as activities, education, and awareness. Using these tools help bring more clarity and focus for the coalition. And after they worked on determining what the messaging were, they had to focus on each of these audiences and determine if they had the right partners at the table. I'm going to turn this over to Linda right now, and she'll talk about the tools, including that partner tool. Next slide, please.
Okay, so the Center for Health and Healthcare in Schools recently developed an online action guide called Partner Build Grow to help communities sustain approaches for child development and prevention through school-community connections. The process can be used for any kind of change or intervention, and we adapted the tools for BCR. In our tool, we identified 4 actions, or prongs, that communities should take in their work towards creating sustainable systems to benefit children. The prongs are building a broad network and partnerships, as well as an action team that focuses on procedure or policy changes, mapping assets, connecting with the policy environment, and communications, which is where Mark's Spitfire messaging tools will be discussed. These are all pieces that build the foundation of information that you will need in your work for change. They are dynamic and should be used throughout your initiative. Adapt them to fit the needs of your community. So I'm going to provide you with an overview of the first 3 tools, or the tools for the first 3 prongs. Each one of them has 2 parts, one that describes how the tools should be used and how they fit into the process. And the second part is a worksheet that will help you collect information. The worksheets can be downloaded and adapted to fit your needs. Mark will then describe the communications and messaging tools. Next slide, please. So, as Wendy mentioned, you want to think about all the people who are involved in the work that you want to do and to build partnerships and a strong coalition. You want your coalition to reach across different communities and organizations, as well as the public and private sectors. The coalition should include all organizations that touch a child's life through services, policies, or community support, such as healthcare, public health, education, faith-based organizations, recreational opportunities, and neighborhood organizations. The Identifying Potential Partners tool helps you keep track of the various initiatives, programs, and contacts. Like all of the tools, you will want to use it throughout your initiative. You'll use it to identify potential partners and collaborators, gather information to help you with your messaging, create a policy action team, and continue to grow and revise your list of partners. So the policy action team, just a little aside, so you'll have a broad network of people, but you may also want to have a smaller group or a team of decision makers who are like-minded, who will work with you towards your goals, who will actually be the ones working towards any policy or procedure changes. You may also want to the action team will focus on the people who make decisions in the policy arena you are interested in influencing. Next slide, please. This is the worksheet for identifying partners. Down the left column, we've identified over 30 groups that you may want to investigate to see if they are in your community, such as community health organizations, local parenting groups, local primary and secondary schools, as well as colleges, universities, and more. But you don't want to stop there. This is just to get you started. Think broadly. The more people and groups who are involved, the more momentum your issues will gain and the more support you will get, both from the community and from those who influence any policies and procedures you want to change. The columns are for the type of information that you want to collect, in addition to some of the basics, such as who to contact and their addresses. You will want to learn something about them so that you can target your communications to them using Spitfire's messaging tool. Next slide, please. This quote is from a member of a coalition in New Hampshire and speaks to the power of coalitions and partnerships. And they wrote, "We felt confident if we put the right people around the table and structured a conversation about the right topics, we could reframe the task and tackle long-term systemic reform and policy change." Next slide, please. So that your initiative reduces the burden of the pair of ACEs on children and adults, you should review the resources and supports that are already available and make sure that they match up with the social conditions and needs of the community. With the Mapping Assets tool, you will collect information on relevant programs, needs, existing resources, and population data. You will then physically show where they exist on either a virtual or a physical map. This will help you identify gaps and overlaps in services and highlight other aims you may want to include in your strategic plan. It is also a great communication tool, for it physically represents what is happening in your community. Next slide, please. The worksheet for mapping assets is designed to help you track the information you might collect. Like the Identifying Potential Partners tool, down the left side are categories of data you might want to consider, such as demographic information like total population, number of children under 18, and the poverty rate, infrastructure like schools, daycare facilities, and health clinics, and health and well-being information like Medicaid enrollment or ER visits. With the partners you've identified in the Identifying Potential Partners tool, you will need to decide what types of data you want to collect to help you determine your strategy and target, as well as what story you want to tell when communicating your initiative. The Identifying Potential Partners tool will also be useful in identifying who to contact about gathering specific information. The Mapping Assets tool, like all the tools, is in Excel, so you can easily adapt it to fit your needs. Next slide, please. So this is an example of an asset map from Washington, D.C. that shows where the grocery stores are in relation to population and poverty levels. You can see how effective it is in communicating the message that grocery stores are not evenly available to everyone in the city. The orange dots are the grocery stores. If instead of a map, I had presented you with a list of figures, it would not have the same impact. Viewing data on a map makes it easier to understand and interpret, and the Mapping Asset tool provides a list of resources to get you started. Next slide, please. So the next tool is the being part of the community of the policy conversation, and it's about monitoring the policy environment and getting to know people who have influence in the areas in which you want to engage. It encourages you to keep track of the policy conversations and meetings that take place as a bill or procedure is being discussed, and explains the times when you could have the most influence on a procedure or a piece of legislation. It also encourages you to know the players, their priorities, goals, and the best ways to communicate with them. As you determine your goal, this information will be useful when you start creating your message. Next slide, please. So with this tool, we've started off by providing some areas you might want to focus on to see if there are initiatives that are being discussed that fit your goals. Like the other tools, it is a means to collect and track information and is meant to be adapted to fit your needs. We recommend that you focus on emerging opportunities by networking and being on top of what is being discussed, connecting to key players and staff, connecting to people who know and understand the budget process, getting to know the priorities and style of the key players or influencer. This sheet is one that will be constantly updated. In addition, this is an area that you may want a subgroup or action group, as I discussed earlier, that will focus just on keeping track of the policy environment. The people in this action team, if you will, should be champions for your cause, be good communicators, and understand the process, the policy or procedure process. Use your potential partners worksheet to help you determine who should be involved. Next slide, please. The last tool I want to introduce you to is connecting to policies and procedures. This tool was designed to help you determine what potential policies and procedures you may want to focus on based on your goals. Unlike the other worksheets, which provide you ways to organize and track information, this worksheet will help you think through how you might want to proceed to reach your objectives. When thinking about how to meet your objective, you will probably identify barriers and opportunities. This worksheet helps you think through both and how to link either to existing policies. When you start thinking about the policy or procedure that you want to change, you should consider all of the other data that you have collected to make sure they are aligned. It would make no sense to have your target putting in crossing guards when you know from your partners that there is already a volunteer group that does a great job and enjoys providing that service. And if you know from your mapping assets that there are very few busy roads that children have to cross to get to a school or a park. Next slide, please. The worksheet walks you through the processes of identifying a barrier and then identifying what the entry points are to change, who you may already know from your networking, who may be able to influence change, and the best means to alter that barrier. For example, after collecting their data and talking to many partners, one group realized that stray dogs were a major barrier to their objective of children feeling safe walking through the neighborhood. The tool leads you through the process of thinking through the policy and procedure changes that would help the situation by asking questions such as, what organizations do you know about that may have influence in ridding the neighborhood of stray dogs? Who do you know that might be able to help? Is there funding involved? Is there a legislative action that needs to take place? And more. The process is the same for opportunities. Let's say you learn from being part of the policy conversation that there is a new mayoral initiative to put new streetlights in neighborhoods across the city, and your objective is to make the city safer. You may link your initiative to this and contact someone with influence to explain that the neighborhood you have focused on has few streetlights, and this could really help with safety. As you can see, you will want to use all the tools together and keep them continuously up to date throughout your initiative. Now Mark will talk about the messaging guide and how information you've gathered about your audience, your networks, and your community will help you in creating your message. Next slide, please.
Thanks, Linda. Those are such powerful tools that they developed, and really allowing your coalition to use those, to build a coalition, to assess the community, understand the community, and engage with policy and advocacy is so important. Communications serves as a perfect partner for all of these activities. I'm here to talk about two of the tools that Spitfire Strategies has developed and are used here within this toolkit. The Smart Chart is our preeminent communications tool that we have. It's been working for thousands of nonprofits for the last 15 years. And it is completely free, and you can access it through the guide, which is on the BCR website. You can use the downloadable version, which you see right here, or there's an online version as well at smartchart.org. But what is the Smart Chart? Why is communications important for all of this work? Well, as you heard Logan state earlier, much of their success in outreach has been being able to connect with the right audiences and connecting through the right messengers and the right message, engaging teens and tweens across all of Oregon through their cultural heroes that are being very vulnerable and open about their issues. Bringing in these diverse partners to talk about the resilience factors that are there, highlighting them within the community, and having respected folks who engage with specific audiences understand that really helps for a successful campaign, like you saw in Oregon, and where they celebrate neurodiversity every day. But the SMART chart is a really condensed communication wisdom in a 6-box tool. The first box is the most important, and what we've heard from so many others is really setting your program decisions. The two things that we ask you to do right there is being very specific with your objective, understanding what you want to do that's related to the pair of ACEs within your community, and have a very time-bound objective that's there. You don't want to solve hunger, for example, but what you want to do is be able to reach X number of schools and kids after schools with meals throughout the summer over a 12-month period. That's the type of specific program decision. And then you get to who's the decision maker. With that, you're understanding who can make the decision. If you can put a name to that, that's even better, as we'll see throughout here. The decision maker might be something, let's say your objective is trying to practice change for pediatricians in your local healthcare system. So they might ask questions about neighborhood safety that's out there, moving them outside of just the symptoms and some of the causes. The decision maker is the head of that pediatrician's program. Being really specific and having a name is great. You cannot use general public or just parents. Being more specific will help this to be more successful. The next box, you go into determining the context, understanding maybe what those pediatricians are facing as they're dealing with many children in the emergency room or on their individual visits. Understanding the pressures that they're under, the processes, the electronic medical records, and their already current practices that they have. Look at your own internal context. Do you have relationships with them? Do they have your respect? Do they understand you? Do you have the time to go out and reach that group? Then you go to the next one, which is probably the most important box there, making the strategic choice. And that's really understanding the field that's out there, the influencers on the pediatricians, and understanding where the pediatricians are. Are you sharing knowledge for the first time? Are you building will to make them change their practices, or have they changed, or one of them changed it already, and you're simply reinforcing action? All of these are critical as then you go into developing the messaging through the message box, which we'll go through next. And then you start building your communication plan after that, determining what are the tactics, what's the budget, what's the time frame, who on your staff, or more importantly, who within your coalition or partnership can you engage to work with this specific group and make that change happen. Then you talk about the measurements of success, you talk about what the outputs are and the outcomes, and you have a plan that's measurable, that can be evaluated, and that helps drive your coalition's main objectives. This is a tool which can be used across the partnership with different groups and multiple times. Something that's very powerful, and what research says indicates that communications that are focused on specific audiences with tailored messaging produces more positive outcomes than standard communication plans or outreaches. Next slide, please. So as we go into, at the core of the SMART chart is the message box. And this is a very simple tool that any partnership, any group, any nonprofit can use to be able to be more strategic and more specific with their messaging and communications. This is designed to help you create tailored messages for those audiences based on their interests, their values, and their barriers. And I'll talk about this in a second, but this is something, a tool, which can be used as you start recruiting new partners, as you start engaging parents around neighborhood safety issues, as you start talking to pediatricians about that type of change that you want to see, the practice change. You start with a values message. One thing you want to do is be able to speak to them where they're at, not where you're at. So your initial topic will say something, hey, let's say for the pediatricians, you care about kids in this community. You care about keeping them well. You'll see them nodding. The message you want to put right there is one that is aligned with their values. At the top of that, you'll see the audience, the value, and the barrier. Those are all things that you'll list out there and you'll address through the messaging. So you've got the values message. You've already got them. You've talked about what they care about. Next slide, please. The next slide shows the barrier message. And we don't want to repeat the barrier. You don't want to say something that is immediately putting the negative in their head. The barrier for the pediatricians might be, oh, we don't have any time. So you don't want to start a message saying, we know you don't have any time, but we'd like to ask you to do this, because you've just already told them, and you're going to have to work even harder to overcome that. Instead, build a message which automatically dismisses or takes care of and answers what their issue is. And what we'd say right there is, by changing some of your practices to help kids, you will be saving time and reducing the amount of kids visiting you for, let's say, dog bites. So this is something which is overcoming the barrier. Next slide, please. Then comes to the ask. The ask message should be one simple, specific ask. Something which you can ask them to do that, what I said before, is doable, that they care about, and is aligned with their values. You don't want to ask them to go out of a limb and do something that this audience is not used to. What you'd like to do is be really specific. And for them, it might be not change their practice immediately, but come meet with the dean of the medical school and the county health director to talk about neighborhood safety and how you can screen for it, to understand why there might be so many issues of children coming in with dog bites, or why kids are not playing outside in the playgrounds and parks and suffering from perhaps higher levels of obesity, childhood obesity. Well, having that ask is very simple. Come to a meeting to learn about this, something that they could do. And then, next slide, please. You end up with the vision statement. And the vision statement aligns, if they complete that ask, it should get them back to their original value. So what you're doing right here is saying, this is the solution. If you're able to meet with the dean and you shift and change your practice, you'll be able to see more kids and have a larger impact on their health in the community. Again, they're nodding again because you know their values and this is something that they care about. So this is an all-purpose tool that you can use. You can start with the ask and go around to the value, barrier, and vision. You can start with the barrier or the overcoming the barrier. You can use this on a CEO from your hospital system to get them to help really support the program that you're on. You can use this with working parents who leave their kids at a church for after school, for daycare, to help them understand some of, let's say, some healthier eating or some options out in the community to help their kids with learning. You could use this on a principal. I've used this on my own family, and it's worked to get some of my kids to eat vegetables on a more regular basis. So it's a very powerful tool. You can ask my kids. Next slide, please. We're going to see now the message box in action. On the next slide, you'll see we built one around the example of stray dogs. Now, we've determined in this that the decision maker would be City Council. And it might not be all 7 members of City Council, but it might be 4 out of the 7. And the value for them that they feel in responding to many of their constituents is that a safer community for all residents in value is a value they care about. The barrier, we're not repeating it, but is saying current regulations aren't working. That's the or they think current regulations are not working, that they have regulations there and they think it's working. What you want to address is say, while we have the right rules to deal with stray dogs, we do not have the ability to enforce them. So their barrier might be, oh, we've got enough, there's enough funding, or there's enough rules in place. Your ask? Let's begin talking about new leadership and the role of Dallas Animal Services. And the vision. You come back with that and saying, a community comes together to address this problem and create a healthier and livable South Dallas. Now, we bring up stray dogs throughout here because this is an issue that is concerning parents, but may not be on the radar for pediatricians that are out there, for nonprofits working in the community, for politicians, and for maybe educators that are out there. All essential elements of your coalition, but the community, they care more about this issue of stray dogs in their neighborhood. Therefore, their kids might not be going to the park after school or on weekends to play. The kids might not feel safe, increasing that level of toxic stress that Wendy talked about earlier, that the community, part of that pair of aces there, is not something that's supportive for the children's growth. And by being able to identify a specific issue, might be the challenge, and highlighting resilience factors within there, how people can come together and address it, you can have a very strong coalition and plan to tackle this. Next slide, please. These are tools, as you've heard, that work together. Whether it's identifying community resources and gaps in services, identifying connecting with new partners, building your coalition, or developing partner building and communication strategies, within the guide that you heard earlier and the tools that Linda and I shared, they work together to create a fantastic outcome within the community. A plan to do it, a strong coalition to make it happen, and success. Next slide, please.
So that's my turn then to put it all together. Thank you, Mark and Linda. So as both of them pointed out, what you want to do with these tools is help you to focus on emerging opportunities and connecting to key players and influencers when those opportunities open. And so in BCR, both of our and two of our cities, in Washington, D.C. and in Dallas, Texas, we've had an opportunity to connect to much larger coalitions by using these tools and these tactics to think about how do we connect to this larger initiative. So in the 100 Resilient Cities Initiative, which is led by the Rockefeller Foundation, aims to connect sectors across city government to create resilience in the face of sudden shock and chronic adversity that BCR is focused on. So in both of these cities, we've created this opportunity for the teams to demonstrate the value of our work focused on the pair of ACEs as a means to accelerate the 100 Resilient Cities agenda around closing health disparities and addressing chronic adversity. So using the BCR tools, as we've said before, you can identify these opportunities, the key stakeholders, creating the value statement that helps you demonstrate the value of your work and effectively communicate the need in your community. So we're really very excited to be able to elevate this work to the highest levels of local and city government, and by sharing our tools with you, we hope you can do the same. So now is the time for questions, and we do have a question here from Washington State about, we have child health mailings that are synced with immunization reminders from birth to age 6, but currently no material on mental health. Do the panelists have suggestions on brochures that introduce parents to toxic stress and ACEs? Well, actually, there are several resources. One, in fact, if you are familiar with ACEs Connection, which is a great online resource for community connecting to other communities doing this work, there's actually an infographic that was uploaded by the Spokane, Washington Health Department. And it is an infographic specifically around toxic stress and ACEs for parents. And so I would suggest going to the website and looking at that and seeing if there's an opportunity to adapt that to your community. So, next question.
We have a question. Are authentic community residents primary or secondary in planning and decision-making? And the follow-up, are local residents paid to work on behalf of the project, and what new capacities do the residents have after the project ends?
Well, we're assuming that our work ends, right? So, yes, absolutely, we do, and what we have done is work with community partners to create more community liaisons. One of the issues that we deal with in working with systems is that there's a high level of mistrust in communities, and we know that that is sometimes very well earned and historical. And so by working with community members, people who are actually residents of the community, not just figureheads, we leverage their knowledge and their ability to bridge between the systems and communities. So they are truly our liaisons, and they work as that voice, but also that representation, but also helping to open the door a little bit wider. We're not just interested in cracking the door wide enough to have one or two people come in, but we really want this authentic engagement and both the identification of the issues that are most important to the community, but most importantly, the co-creation of solutions. One of the things that is very central to BCR is this acknowledgement that many times those that are in the community already have identified the priorities and as well as identify potential solutions. So tapping into that vein of knowledge before we create an action plan is absolutely essential to the BCR work. As far as local residents being paid to work on behalf of the project, that's a large part of our policy agenda for this. So as that last slide that I was talking about talked about connecting to both policy and practice change, is that we feel that it's just as important for community time to be reimbursed as it is for some of our individuals who are representing systems and organizations. And so, of course, that goes back to why it's so important to be able to demonstrate the value of our work and be able to work with systems so that we're not just using volunteers and community as an extension of our work to get it done, but that there actually is some way of rewarding community members for the value of the work that they bring to the table. So any other questions are coming in line here? So we're getting a lot of questions about the PowerPoints and about the recording. And so the recording will definitely, we have been recording this webinar, and this will be up on our site later on today. As soon as we have permissions from our partners, we will make the PowerPoints available. So if you want to join us, oh, wait a minute, we have one more question.
The question is, could you address the challenge of coordinating city-based efforts with statewide initiatives?
That's a really challenging one. So our groups right now, for the most part, are taking what are very neighborhood-centric efforts and trying to link them to city-based efforts. I don't know, Logan, are you able to speak to joining up to more statewide level initiatives with your work?
Sure, yeah, I can try. We are just about, we're in our third year of the campaign, and one of the things that I think the nonprofit sector does, is we all try to reinvent the wheel for ourselves. We all want our own funding. We all want to do our thing, which is why there's a nonprofit for every 200 people in this country, and all the social problems still exist. So I think my commitment, whether that started with the Keep Oregon Well Mental Health Heroes or flattening competition, my commitment was to not rebuild something, but instead have our platform be able to connect to existing other social movements, and also provide space for other people to join us. So on the sort of like on the branding side of things, there was an existing social movement around Keep Portland Weird. And so if you look at Keep Portland Weird, there's this whole community of people who have the bumper stickers and the T-shirts and have sort of subscribed to that. So we worked with the people who had done that campaign and exactly replicated their branding, so there was an instant recognition, and built our social movement around sort of slightly tweaking that existing thing. When we've thought about taking things to scale in other states, you know, the first thing I would suggest doing is looking at what already exists. So, you know, if you're going to take it to California, do something there, maybe you look at what the state slogan is. And in California, I know that's Eureka, so maybe it's Eureka Wellness. That's not the best idea. But just as an example, one wants to look in there and figure out where people are at, what they're already gathered around and mobilized around, and then try to plug into that. And on the practical level, you know, there's been a few really well-funded anti-stigma efforts, Trauma-Informed Oregon, Oregon is the healthiest state, and each of those has a major health system funding it, but has not reached community in exactly the same ways that we have. So I think being able to, you know, get your board and your executive team and all your staff centered and aligned around we're not in competition. If all of us joined forces, we would still not be able to meet the need, and then move forward together with that sort of framing. There's real power in that. And you know, collective impact, everybody loves to say that, but it really is messy by design. It really is, it takes a lot of work, a lot of foundation laying, and I would just say that that work is super worth it. Every moment of time I've spent getting to know other people in the field who are doing this work, getting to know other people in the field who might be against this work, trying to bring the community along to agree on the issue at hand. Had we not done that on the front end, we would really have hit some walls as we got into the actual delivering.
Wendy, this is Linda, I can speak to that just a little bit as well. That was fabulous, Logan, thanks. But I think to a large extent that's what we talk about when thinking about opportunities that are available and connecting to the policy environment, is really knowing what is going on and seeing where the effort that you're doing locally can fit in. On the website for our toolkit, Action Partner Build Grow, we have a couple of case studies, including one from northern New Jersey where, and these are all school-connected initiatives, so keep that in mind, but where they recognized that there were students in middle school who are having stress and other social and developmental issues, as many middle school students do. But they pulled together an initiative by gathering a coalition from amongst their community, very broad-based, and recognized that they could tie their initiative into the New Jersey Anti-Bullying Bill of Rights that had just come out. Similarly, a community that we've worked with up in Binghamton, New York, Broome County, New York, was able to tie their local initiative to, I believe it's the Promising Neighborhoods initiative that New York State was developing, so that there was coordination, and it all really hinges on knowing what's coming up and down the pipeline and having those networks to be able to influence what's happening and be connected with it.
So thank you, Linda. Actually, that helped to answer one of our next questions. Was it seems like you addressed steps to start coalitions, basic elements, processes, how to help organizations already engaged. And if I heard you correctly, you were speaking of existing initiatives and organizations that were engaged in a substantive body of work that saw an opportunity to accelerate or create a larger audience for even larger opportunity for their work. Is that correct?
Yes, that's absolutely correct. A lot of what we've worked with is actually helping to sustain initiatives that have already been started and are there, and how to grow them and integrate them within the rest of the system so that they are sustainable.
Thank you. There's been a lot of interest in the tree graphic, and as I mentioned earlier, that is absolutely a BCR tool that we put out there. We encourage your use on that, of course, with proper citation. But yes, I mean, we found it to be quite effective across academic audiences, community audiences, key stakeholders, and we felt that it was just too good to keep to ourselves. So yes, we encourage you to share that, to use it, to create your messages just with the proper citation. We also had a question, I think we've got time for just one more question, it seems, about how BCR may work in rural or small communities. And I think what we're talking about, and Linda, Mark, and Logan, I'd love for you to chime in here, are really basic principles of coalition building that are applicable across different communities. You scale your work, obviously, to the resources and the organizations that are available to you, but very much so these principles could be applied to almost any community. Mark, Linda, Logan, if you want to weigh in on that.
Yeah, this is Mark briefly. So if you take, for example, some of the rural areas that are facing economic downturns and opioid epidemics, by working with coalitions or groups of organizations that community members already have trust in, as Logan had mentioned before, and they might not be tied to ACE's work or the pair of ACEs, but the outcomes there are something that resonate with ACEs. And so using a lot of the communication tools, you can adjust the messaging to make sure that their values and interests are aligned with what you want to accomplish. And you can use the other tools to build a stronger coalition with shared common objectives. I'll turn to someone else.
This is Logan. I would just add to that the internet has no borders, right? And neither do sort of multimedia companies like radio. There's our mapping of the community with our messaging platform and our social media engagement does reach rural communities across Oregon because we partnered with radio stations that are available there. We've partnered with local TV media that airs in those areas, and most of our engagement outside of the events happens online.
And I would just add, nothing particularly new, but we have used the action guide in rural communities, and it's the exact same process. That's what our focus is on. You develop those networks, you reach a common goal, you determine similar messaging, what you all agree on, you communicate it, and then you look for ways to work together and to coordinate with other, with state and district entities that are already also in this arena.
So I want to just take this moment to thank everyone who attended today. As I mentioned, all of our tools and resources are available on the BCR site. If you'd like to join our community, you can join us on Facebook. Just search for Pair of ACEs, and we'd love to have you join the community, the larger place where we can share information, share our stories across our various communities on our efforts. And of course, for regular updates, we're on Twitter at @ResilNation for updates. Really, I want to thank Mark Dessauer and Linda Sheriff and Logan Lynn for your help today. And everyone out there, go out and build your own community resilience. Thank you so much.